There's still no end in sight 6 months after the world was hit by the COVID-19 pandemic. The virus has infected nearly 30 million people, and in a few weeks' time, those who succumbed would have surpassed 1 million. Recently, I headed to Ground Zero, the central Chinese city of Wuhan, where it all began, to find out how life has changed for the city of 11 million. We'll also take you to other parts of the world to witness the journey of recovery as humanity pinned their hopes on finding a vaccine to bring an end to the pandemic.
痕迹看不到，但是实际上它没有消失，很大一部分还在大家心里面。就像城市恢复或者经济的恢复，其实都很容易也很简单，但是心理上的创伤恢复去掉很难。
Things may look normal in Wuhan now, but Wu Hui still recalls the fear and confusion in the city between late January and early February. That's when the city was thrust into the unwelcome glare of the global spotlight after China officially confirmed human-to-human transmission of COVID-19 on January 20th. A harsh lockdown was swiftly imposed on the city just 3 days later. But before this, local authorities repeatedly assured residents that human-to-human transmission of the virus was limited.
当时虽然很生气我觉得 我们的应对有各种各样的我认为的不对或者不足的地方，但是现在看，其实我们应对还算是比较不错的，这是比较客观的评价，我认为的。
Wuhan accounted for 80% of China's coronavirus deaths, leading to widespread fear and panic. But it has reported no new infections since May.
你根本都不知道下一个是不是你呀，那种恐惧。 但是自从那一次看到是什么，看到解放军坐着飞机来，哇，那是国家开始出手，那种感觉的话，真的很多人都流泪。
We visited Wuhan earlier this month as part of a government-organized tour. Over 3 days, officials took pains to show us Wuhan's recovery, from an elite school to a vibrant park and a modernized wet market, all carefully selected scenes of vitality and a new normalcy. At a government hospital, we were told by Hospital Deputy Director Liu Jihong that while there were moments of stress, the government turned things around quickly. He says this couldn't have been done without a strong leader, and that looking at the international coronavirus situation now, he feels lucky to be in Wuhan. After the government tour, we stayed on to do our own independent reporting. The streets are bustling and life is pretty much back to normal in Wuhan. We've been here for about a week filming and interviewing, and our work has been going on smoothly and unhindered for the most part, except in a couple of places. We were followed and questioned at the Baibuting residential estate, which was infamous for hosting a 40,000-strong Chinese New Year banquet at the height of the outbreak. And at the boarded-up Huanan seafood market, a possible ground zero for the coronavirus, we were stopped from filming and told to delete footage we had filmed.
What we've observed about this particular Chinese leadership is that they are very anxious about many things, a great many things. And I suppose one concern would be the unhappiness or any lingering unhappiness over the earlier mishandling of the coronavirus outbreak could result in some sort of greater political movement or opposition that it does not look favorably upon.
China, however, insists it's acted in an open and transparent manner on the coronavirus outbreak. Today, Wuhan is back to normal and back in business. Schools and tourist sites have also reopened. But while the city was under a tight lockdown, those who tried to speak out were hushed. Still, the death of Dr. Li Wenliang, one of the doctors who first tried to raise the alarm about the coronavirus outbreak, triggered widespread grief and anger. On February 7th of this year, I saw something I had never seen before. For at least a couple of hours, nearly my entire Chinese social network was posting about the same thing on WeChat. And when I checked Weibo, China's version of Twitter, there was a near unanimous outpouring of grief about Dr. Li Wenliang, with many sharing his quote that there should be more than one voice in a healthy society. Today, China's coronavirus death rate ranks low by global standards at less than 4 in 1 million, versus 569 deaths for every million people in the US. Along with this success comes state-led efforts to recast victims of the coronavirus as heroes. But this tighter control of the coronavirus narrative also means that a diary that Annie Lee co-wrote with some friends will not be published. With her father working as a doctor on the front lines, Annie was documenting everyday life and challenges faced by Wuhan residents. But the publisher recently rejected her, citing sensitivities around printing personal diaries memorializing China's coronavirus fight.
我在12月的时候就已经意识到这个事情大概就是可能会成为武汉历史中一个特殊的事件，然后我就想，既然是对我们这么重要的一个事件，我们应该更多的去记录自己真实的生活和身边人的生活，而不是让这个历史就停留在那些大事件的记录。
People like Wu Hui and Annie took to journaling as they saw it as a social duty to record the events unfolding before their eyes. But they say it was also a means for them to cope with everything that was happening. Elsewhere in what China calls a city of heroes, businesses are also doing their bit to contribute to the recovery of the city.
我们现在把酒水的价格已经调到基本上是零利润在做。这样，因为其实疫情之后，我考虑到2个方面，一方面是所有人都有经济上的压力，大家也需要去释放；第二方面，我希望就是用这种低价格的，就是接近成本的一个酒水，来给大家就是尽快恢复到之前生活当中，就是休闲啊也好，或大家放松也好，就是起到一点点的作用吧。
But even as Wuhan celebrates a hard-earned return to normality, there remain unanswered questions over how well can China or even the world weather another public health crisis. After all, lessons from the 2003 SARS crisis appear to have gone unheeded. And as the world continues grappling with the devastating COVID-19 pandemic, a global health monitor has warned that it's doing far too little to prepare for future, possibly even more damaging pandemics.
New York City was brought to its knees 5 months ago when it became the epicenter of the American coronavirus outbreak. More than 19,000 lives were lost. A 3-month lockdown eventually brought the outbreak under control. The infection rate has remained below 1% for more than a month now, and the city is well into phase 4 of reopening. That's the final stage. Just cinemas, theatres and indoor restaurants remain closed. But it's not over yet. The threat of a second wave lurks around the corner, and New Yorkers remain on edge.
At the very height of the outbreak, temporary morgues were set up on the streets of New York. Deaths peaked at more than 800 a day in April. The pandemic has taken its toll on many people here, as the once vibrant city turned lifeless. Lucy Richardson is classed as being at high risk because she has several chronic conditions. She spent most of the last 6 months sheltering in her apartment. She has recently begun venturing out to a nearby garden, but she says the months of confinement have had a psychological impact on her and the whole city.
I wake up, I go to the living room, I turn on my laptop and I work, and then later maybe I move to the couch. It's definitely been very repetitive. You know, I'm right near the FDR highway, and every day I watch the cars, and it was spooky for it to be peak hour and hardly anyone out there. I always said I wanted to, in my lifetime, witness some great historical event. I didn't mean this. To know that we're in the city that never sleeps. Well, the city didn't sleep, but it definitely went indoors.
5 months on, and the city is now seeing a daily average of around 6 people dying from COVID-19. Health experts say that's still too many, but it shows huge progress has been made, and they credit that to tough lockdown restrictions and improved medical care for coronavirus patients. With an estimated 92% of office staff still working from home, the city has avoided a predicted second wave of the virus. Some scientists believe this is also partly because there are New York communities which have developed herd immunity. Other experts are more cautious.
It's more controlling the virus. I wouldn't say it's defeated yet, but it's controlled. I mean, the best estimates are maybe 20% of the people in the city were infected at one time, meaning 80% were not. So there's still the vast majority of people who are susceptible to getting infected.
So with schools here set to reopen soon and autumn flu season just around the corner, there are concerns that the current low infection rate may not last. And that would be a bitter blow to a city where some businesses have been closed for nearly 6 months now, contributing to an unemployment rate of nearly 20%, almost twice the national average.
Those empty shop fronts are a constant reminder to New Yorkers of the balance here between a healthy population and a healthy economy.
A lot of the places that I used to frequently go to, they're closed. So I think that's what I think it's really unfortunate. I mean, in a way, that's the price we have to pay to be safe.
Health experts say other states may be able to learn lessons from New York's experience, but that it's still too early to be sure the model set here has really been successful.
The Trump administration is betting on a COVID-19 vaccine to bring the pandemic to an end. Through Operation Warp Speed, it hopes to produce a vaccine in record time. The urgency has taken on political importance as Donald Trump seeks re-election in November. But as the hype around a COVID-19 vaccine intensifies, public skepticism about vaccines is also on the rise.
These scientists in Maryland are racing to create the first approved COVID-19 vaccine in the US. The developer Novavax says it's being very aggressive with its timeline to try to get the drug available publicly by the end of the year. Medical bodies like the Centers for Disease Control, the CDC, says an effective vaccine will be essential to stopping the virus spread. But vaccine mistrust has increased in the United States in recent years. Curtis Cost has written books campaigning against their use and is one of a growing group of people known as anti-vaxxers.
I'm concerned about what's in the vaccine. I understand it's an entirely experimental approach.
Medical experts say that developing a vaccine is the only way to get on top of the coronavirus pandemic. Are you worried that by saying a vaccine isn't safe, you could make the situation worse?
Well, I mean, first we have to look at the credibility of the CDC. The CDC is the same group of people behind the notorious Tuskegee syphilis experiments in which black men were allowed to have syphilis for decades.
The 1930s Tuskegee study, which carried out tests on people without their consent, is seen as the root of much mistrust in public health bodies in the US, particularly amongst African Americans. But there's concern that doubt about a coronavirus vaccine is also being exaggerated by modern political differences.
The campaign to develop the US cure is being spearheaded by President Donald Trump, with Operation Warp Speed aimed at delivering just before he faces election. The president has also previously undermined his own public health advisors and advocated for unproven treatments like taking an anti-malaria drug to treat COVID-19. The Public Good Project has started a campaign to address false information, but says current events are causing vaccine aversion amongst people who usually trust medical advice.
Part of that is because of the dismal U.S. response to the pandemic. So it's fueled the perception that public health and science authorities don't know what they're doing. And then there's also the legitimate questions. The public doesn't associate speed with safety. And we have not done a good job explaining what Operation Warp Speed actually is.
Medical experts warn that a poorly executed vaccination program could limit the effectiveness of any cure. They say a new approach is needed.
Before we start to talk about what we want people to do, maybe we should listen to them carefully about how community residents have reacted to COVID-19 thus far, what their fears and concerns are about a vaccine, and then develop appropriate messaging around taking the vaccine that's based on what we know about the barriers, the obstacles, and the negative attitudes people may have towards this kind of medical intervention.
But with at least 3 vaccines now in advanced trial stages in the US and the CDC asking states to prepare for a rollout in November, time is running out to win people over.
This month, India surpassed Brazil with the second highest number of coronavirus cases in the world. The daily caseload here is the highest in the world. Still, the Indian government is reluctant to impose another lockdown after the economy shrank by a record 23.9% in the first quarter of this year. Government officials believe that a COVID-19 vaccine is India's best hope in the fight against coronavirus. But even when a vaccine does become available, India will be confronted with the mammoth task of vaccinating its 1.3 billion people. Ranjana Mehta has been on the front line of India's vaccination program for almost 2 decades. As a healthcare worker, she worked to eradicate polio back in 1990s, and now she's immunizing children against measles and tuberculosis. Once a COVID vaccine becomes available, frontline workers like Ranjana will play a crucial role in bringing it to the most impoverished parts of India. With tens of millions of Indians living in areas with poor access to healthcare and education, Ranjana says the toughest part of her job is to convince people that a vaccine is safe.
पहले तो बहुत ना के बराबर ही टीका लगता था क्योंकि टीका लगवाते बुखार बच्चे को आ जाते हैं इसके डर से वो टीका नहीं लगवाना चाहती है अब वो ना के बराबर है अब लगवाते हैं कुछ ऐसे आदमी हैं जो टीका नहीं लगवाते हैं अभी भी तो आप देखिए वैक्सीन के लिए कितनी सक्षम होती है लगाने के लिए मुझे तो नहीं लगता है जो सारा लगवाएंगे कॉलोनी में जब हम जाते हैं सर्वे करने के लिए तो वहाँ की मतलब गेट नहीं खुलती है
In this poor neighborhood in Delhi, some have never been vaccinated in their lives, and they are reluctant to immunize their children as well.
जब कोरोना ना हो जाए पहले से डर होता है मैं कई बच्चों लोग सुइया कुछ नहीं लगाई हूँ टीका थे कुछ नहीं लगवाई हूँ मुझे डर होता है इसकी जिम्मेदारी कोई लेगा कुछ हो जाए तो
हाँ इसके लिए होती है कि वो समझाए थोड़ा अब आता ही चेक करना स्टार्ट कर देते हैं आदमी घबरा जाता है ठीक है घबराने के कारण कभी भाग जाता है कि नहीं भाई मैं नहीं लगाऊंगा
It's estimated that it could take up to 4 years to vaccinate India's entire population of 1.3 billion people.
I think the Pulse Polio program has given us a lot of lessons on how to reach the unreachable. And I think those people who have been involved with the polio program and the strategies that were adopted, whether it be social marketing, whether it be getting religious leaders on board, and whether hiring other extra workers to go the extra mile. So those are the things that the government has already done it. So it has to be repeated for COVID vaccine.
COVID-19 has exacted a heavy toll on India, but the country is not entirely vulnerable in the face of the coronavirus. India is home to some of the world's biggest vaccine manufacturers. The country is capable of producing up to 3 billion doses every single year. This means that when a COVID vaccine does become available, India will be better placed than most developing countries in securing a vaccine for its people. While India waits for a vaccine, Mr. Shankar of IBE Global says there's still much the government needs to do. As Delhi's frontline worker, Ranjana would tell you, finding a COVID-19 vaccine is really just the first step.
टीका लगाने का टाइम आया अभी मैं बुलाने जाऊंगी तभी पानी का टाइम आएगा यहाँ तो पानी वो भर के काम उम करके आराम से आएगी तो तब टीके दीदी चली जाती हैं ये बहुत समझाने के बाद में लोग एक दूसरे को बच्चों को देखा है जो इसका टीका ठीक है या कुछ भी है सेफ है तब जा करके लगवाइए ऐसे ही होगा उसका भी
The COVID-19 pandemic is expected to push an additional 4.9 million Indonesians into poverty. Imposing another lockdown, reasoned the Jokowi administration, would bring more economic misery to its citizens. This despite the rate of new infections climbing. The Indonesian government has instead focused its efforts on securing a vaccine for its people. Indonesia has made itself a testing ground for a Chinese COVID-19 vaccine. Late-stage trials on humans are currently underway in Bandung, the capital of West Java province. Much optimism is riding on these trials, but scientists warn that even with a vaccine, the road to rebuilding lives and livelihoods will likely be a long one.
32-year-old Nina Fatima has experienced firsthand the economic pain inflicted by the coronavirus. An assistant at a local clinic in Bandung, the capital of West Java province, her husband was laid off as Indonesia's economy struggles under the weight of rising COVID-19 caseloads.
Dampak terhadap hidup saya, yang pasti yang terasa dampak banget buat saya, suami saya juga kena dampak ya. Jadi ya mengandalkan rumah tangga saat ini, mengandalkan penghasilan dari saya, dan suami saya juga sekarang jadi ngojek. Ya, terasa banget lah dampaknya, luar biasa.
Refused to sit still and do nothing while watching the virus run rampant, she became one of over 1,600 volunteers in a late-stage trial of a COVID-19 vaccine developed by Chinese firm Sinovac Biotech.
Kalau misalkan mengikuti jadi relawan, otomatis saya sendiri akan terbentengi dan keluarga saya sendiri tanpa secara tidak langsung terbentengi sama virus ini.
In August, Sinovac kicked off human trials of its CoronaVac in Indonesia. The Phase 3 clinical trial will last for a period of 6 months. The Chinese vaccine candidate is among just a few in the world to enter large-scale human trials, the final step before regulatory approval.
If everything goes smoothly, a production deal between Indonesia's state-owned biopharma and Sinovac will guarantee the country the supply of some 50 million doses of CoronaVac from November to March. It will also give Indonesia priority access for the rest of 2021.
President Joko Widodo is convinced that the threat of COVID-19 will not subside until people are vaccinated. He has said that if everything goes according to plan, vaccinations for the public can hopefully begin in January 2021. But scientists caution that a vaccine doesn't mean a quick end to the pandemic. A vaccine's efficacy may vary, and one key question they still don't have the answer to is how long will the antibodies last?
Penelitian ini kan 6 bulan. Kita ingin melihat apakah selama 6 bulan ini antibodi yang terbentuk itu masih tinggi setelah penyuntikan, ya. Kalau masih tinggi, tandanya daya tahannya bisa lebih lama. Tapi kalau mamanya setelah 6 bulan dia mulai menurun, barangkali setahun kemudian mesti diulang lagi, gitu. Jadi kita belum tahu nih.
Indonesia is an archipelago of some 270 million people, and each individual will likely need to have the vaccine administered twice. Professor Kusnandi says up to 80% of the population must be vaccinated for a mass vaccination procedure to be effective. Biopharma's current production capacity for a COVID-19 vaccine is 250 million doses per year. The company acknowledged that it will take time before it can produce enough doses to provide immunity for everyone.
Kalau skenario kita lancar, semuanya berjalan lancar, ya sekitar Maret April itu mestinya sudah bisa kita produksi dan sudah bisa diberikan ke masyarakat, tentunya dengan kapasitas atau dengan jumlah yang tentunya belum banyak ya, karena kita bertahap untuk produksinya bertahap, tidak bisa sekaligus.
A vaccine may not be a quick fix, but for a country that could ill afford another harsh lockdown, it is still a crucial first step to rebuilding people's livelihoods. And the supply deal will hopefully give the country a head start when a cure is within reach.